My talk today was part of the cooperative group session for elderly patients. So as an organizer, I can tell you that we decided to have two sessions, one for younger patients and the other for elderly patients, for just to know what has been recently completed, what is ongoing in these groups, and to share the group's perspective, etc. So I think the session went well, in fact, and each group has had a 5-minute presentation, some 5-10 minutes presentation, and we had a panel discussion at the end. So what we say, so my presentation was on behalf of the French myeloma group, the IFM, and so what has been, I can tell you that, as you know, what has been achieved in IFM in the past couple of years is a very large study, which is named the first study. The first study is named IFM 2007-01 MMO20 because the study is sponsored by Celgene, and the other name is the first study. This is important because this is the largest study ever conducted in elderly patients. So we have enrolled, this is not only an IFM study, this is an IFM and global study, and we enrolled 1,623 patients in a lot of countries and in approximately 300 centers. So it's a huge study with also a very large subgroup of very elderly patients. For example, we have 36% of patients over 75, so that's more than 500 patients over 75. So obviously the study has been completed last December, so no results yet, but the study will be very important next year for the future. That's very important. So basically the study has compared the standard MP thalidomide arm versus two different lenalidomide low-dose dex arms. One was 18 cycles, and the other was until progressive myeloma. And so many people are looking for these results, and so the final results are eagerly awaited. But I think we will probably say something about the study at the end of 2012, not before that. Several highlights, in fact, but I think that probably the most important was this afternoon. As you know, we also designed a special session for, I would say, for the malignancies, the second malignancies. So this issue arose at the end of last year, coming from 3 different randomized trials conducted with lenalidomide in combination or just after melphalan. And so we decided to have an update on these 3 studies. So basically these 3 studies are the MMO15 from Celgene MP versus MP lenalidomide, and 2 studies conducted in a transplant setting. One is IFM 2005-02, and the other is the study conducted in the US, the CLGB study. And so these studies had been presented at HASH at the end of last year, and at that time there was no survival difference in 15 CLGB and IFM, and today we have heard that there is a survival benefit in favor of the lenalidomide arm in the CLGB, not in the IFM study, but these survival curves have been presented for the first time this afternoon. So this is something important. So we may say that, okay, we need some additional follow-up. What is the importance of this survival difference? So it has to be discussed. But anyway, it's something important, and I think it makes a difference in the U.S. At least in the U.S., because in Europe and in other countries, lenalidomide frontline has not been approved. So it's not, I would say, for example, in my country, there is no use of lenalidomide maintenance at this time. But in the US, this issue is very important for the routine practice. In Europe, usually we need a formal approval. So as you know, the company has asked for formal approval, for formal EMEA approval based on 015, and IFM and CLGB as supportive studies. So it's an ongoing process. So, but we don't know what will happen, but it's an ongoing process.